I think the stigma attached to people who provide abortions is very strong in our society, and it actually happens in other countries as well. So doctors just don't feel comfortable with the idea that it's part of a health service that women need. It's part of their rights, actually, to be able to control their own reproductive function. Well, Klinik Rakyat actually started off as a general practice clinic, and we added the idea of providing contraceptive services and abortions as part of the service. And it was very obvious to us that there was a need for contraceptive and abortion services.
Dr. Choong, an anaesthetist by training, started Klinik Rakyat 37 years ago. Today, his clinic is possibly the only women-friendly clinic in the country that provides abortion services openly.
We started off, of course, with one doctor, but now we have actually 3 doctors working here and about 15 support staff. And this is because the workload has increased over the years. And so we get about 4,000 women coming here every year. Most of them, maybe about 80%, actually are seeking to have a termination of pregnancy. But we will do other services such as general health care like pap smears, contraceptive pills, injections, IUCD insertions, and so on.
Unfortunately, due to misconceptions surrounding abortion in this country, most women who need an abortion don't even know where to go.
Actually, I'm from Ipoh. I didn't know where to find a clinic that would do abortions. I was so worried and so scared. I cannot have a baby because I'm still studying. My boyfriend is also studying and we are not ready to get married.
As a single woman, Lily's case represents only about 15% of all women who come to Klinik Rakyat for an abortion. Most are married, but due to various reasons, end up with unintended pregnancies.
Most of the couples that come here, they are married. Some of them, they might have an abusive husband, whereby they cannot carry on with the pregnancy. And then sometimes they do have a retarded child or handicapped child that they cannot cope with another more child.
Yet other cases involve rape and incest. Haslina Yaakob runs a women's shelter for abused women. She understands the trauma of being forced to carry the consequences of rape to term.
Satu kes yang saya telah handle di mana klien saya telah dirogol dan dalam masa 2 minggu dia telah mengalami kehamilan. Maka saya bawa dia pergi ke ONCC di ONCC dan mereka memberitahu dia bahawa hospital tidak melakukan pengukuran untuk mereka yang tidak berkahwin. Ini amat mengecewakan klien saya.
There is no official policy for the provision of abortion services in public hospitals, even though the law clearly allows for it under reasonable conditions.
Sebenarnya undang-undang membenarkan pengukuran janin mengikut Seksyen 312 Kanun Kesiksaan. Dia mengatakan kalau seorang pegawai perubatan iaitu seorang doktor berpendapat bahawa kalau dia diteruskan kehamilan ini akan menyebabkan wanita tersebut menghadapi risiko pada mental dan fizikalnya, maka doktor ni boleh hentikan kehamilan ini. Kebanyakan orang tidak tahu tentang undang-undang ini. Orang ignorant tentang hal ini. Dan persepsinya ianya satu kesalahan di segi undang-undang. Dan juga mungkin orang berpendapat bahawa agama mereka tidak membenarkan pembunuhan janin. Kalau dalam Islam sebenarnya ada fatwa yang mengatakan sehingga janin itu berumur 120 hari sebenarnya boleh. Walaupun bagaimanapun, at the end of the day, ini antara wanita tersebut dengan Tuhannya. Bukan hak kita untuk menghukum mereka sama ada mereka patut atau tak patut buat. Ini adalah badan mereka sendiri dan mereka mempunyai hak atas badan mereka.
Saya beragama Islam. Okay. Saya takut apa yang saya nak buat ni orang akan kata salah di sisi agama. Tapi saya ada baca buku dan tanya kat Ustaz. Ustaz kata selalunya 120 hari baru roh ditiup kat dalam janin kita. Cukup sifat. Tapi sekarang saya mengandung hanya 3 bulan. Kurang daripada 120 hari. Tapi saya rasa bersalah. Saya nak buat ni. Saya pun semayang dan berdoa kat Tuhan supaya Tuhan ampun dosa saya dan kesalahan saya. Tapi saya ada bincang dengan suami saya. Suami saya pun setuju. Kerana kami ada 5 orang anak dan tak mampu.
There are those who come here for termination of pregnancy, and there are those who come here to seek sort of advice on contraceptive. You know, some of them, they really totally have no idea what are the methods that's available or is suitable to them. So they would like to know more about it. So we have to counsel them and teach them how to use it correctly. But of course, there are no perfect contraceptive methods because there are always either is the user failure or a method failure.
Ong, who has 30 years' experience as a counsellor, says that usually men don't want to get a vasectomy or they complain that wearing condoms gives them no satisfaction.
We do counsel them on the options. Either they want to carry on with the pregnancy, and most of them don't prefer to send it for adoption. Because they will tell you, if I want to send it for adoption, I might as well keep this pregnancy. So normally it is the wife who is going to undergo all these trauma.
Yes, it is rather sad, that basically it is difficult to find information on where to get abortion services. Many doctors who provide the services will not announce it, will not let people know about it. And so it means that they have to look around, they will waste time, and of course with pregnancies, every week that it gets bigger, the procedure becomes slightly more complicated. And then sometimes they do abortions in places where they are really not skilled enough, so we do have some botched abortions which we have to salvage. So all these are consequences of a situation where we do not want to openly admit that abortion services are a necessary part of women's health care.
Before we allow them to come in, this window acts as a triage where the first screening will be from this window. The purpose of the visit in private, not too loud, and then the door is unlocked for the patients to come in.
Once the patient is inside, she will be registered at the counter. Other inquiries will be answered at the counselling booth away from the waiting area.
The reason being they might want to speak to a private, that the visit here is confidential. They don't even want their partners to know they are here for that purpose.
At the counselling booth, the patient's intimate questions about the procedure, for example, the duration, the pain factor, and whether it will affect their fertility, will be discussed. They will then be taken into a private area to wait their turn to see the doctor.
So we try to keep with the signage here for female patients only. But if it's quiet like today, the couples are allowed to sit around.
To keep the environment clean, clients remove their shoes before going upstairs. Then another short wait before they go in for the procedure.
Is she ready for pre-med?
Yeah.
Given?
Another 20 minutes.
Oh, not given yet. Have you given advice on this? Who is this one?
This one is...
Yeah, room B. This is one of the 2 operation rooms. Basically, we try to keep it as asurgical, meaning we don't want to frighten the patients with white drapes and stuff like that. So we make it very comfortable. Procedure is only about 10 minutes for a small case, what we call small case. The wheelchair is ready to transport patients from the operation room to the restroom if it's required. But some patients prefer to walk because they don't want to make themselves look so sick after a minor surgery. This is the restroom of 9 beds, and where the patients will come in after surgery for a short rest. When they're ready to go home, we will make sure that they pass urine, they have no pain, and then a hot drink is given before they're escorted downstairs.
For those waiting for their transport and don't want to wait with the other patients downstairs, they can relax, listen to music or read books and magazines in the library.
There is certainly very wide misconceptions about what abortions are like and what the procedure involves. Obviously, it is because in the past, you hear terrible stories of botched abortions, people dying of bleeding, and so on. And of course, the other thing is that they also have not realized that there are changes in medical technology which have made a lot of difference to what an abortion involves. In the past, they would give a general anesthetic, they would use metal instruments to scrape the womb, which is much more traumatic than modern technology. You go in, you have some light sedation, you have a local injection, a local anesthetic injection, and then the procedure is done using a plastic catheter to suck out the contents of the uterus, and then you're done.
Like its namesake, Klinik Rakyat has earned its stripes as the People's Clinic. It has won praises from across the region as a model women-centered clinic. In fact, the Thai Women's Health and Reproductive Rights Foundation sends their trainees to Klinik Rakyat 3 times a year to observe its practices.
It is essential for not only health providers and policymakers, but also the general public to take a more sympathetic view to women who are faced with the problem of an unintended pregnancy.
RRAAM hopes this video will help raise public awareness that access to safe, women-friendly abortion services is an essential part of healthcare for women. Abortion is legal in Malaysia. Thus, women, when faced with an unintended pregnancy, do have the right to decide on whether or not to continue with it. This right to reproductive choice is as critical to women's equality as fair access to education, employment, and choice in marriage. Both surgical and medical abortions are safe when provided by skilled personnel. Serious complications are virtually negligible.